want you to imagine that when you wake up in the morning, you're not at home in your bed, but somewhere completely unfamiliar. The room is cold and bare looking, and there are no clues as to what this place might be. It could be a hospital, but it could be a prison, or it could be an institution, the kind you remember your relatives talking about with fear when you were a child. Please don't let it be one of those. You try to get up, but there are rails on the side of the bed to stop you. It must be some kind of prison. You have to get out of here. You need to get home. You need to be safe. Then you hear noises coming from outside the room. Voices, people talking and laughing, alarms sounding, phones ringing. Is that your phone ringing? You need to answer it. It could be somebody that might be able to help you, but you can't get to it. Where is it? Nothing makes sense. Your mind is in a fog. You don't remember how you came to be here, and no matter how hard you try, you can't remember yesterday. The door opens and a woman walks in. You don't know her. She doesn't look familiar, but she seems to know you. She's calling you by your first name. Her words are coming out fast, and you can't keep up with what she's saying. Now she's looking at you, waiting for an answer, but you don't know what the question was. You try to explain. You're not supposed to be here, wherever this place is. There must be some mistake. But she just laughs and says, "Don't worry, you'll be fine, we'll look after you." And then she's gone. But you are worried. You don't know where you are, why you are here, what has happened. Where are your family? Surely they wouldn't have left you in a place like this. The door opens again and another woman walks in. You think it's a different person, but you can't be sure. But this person seems different. They are smiling, they look kind. They sit down beside you and introduce themselves, tell you their name and say that they're a nurse. They explain that you're in hospital, and you recognise the name of the hospital. It's the one near to where you live, and it's not such a bad place. She says that she can see you look worried, and she takes hold of your hand. She explains why you're here, how long you've been here, and that you'll be going home tomorrow. She asks if you'd like a cup of tea. Yes, you would, and some breakfast. She's going again now, but she says she'll be back with the tea. She seems nice. Maybe you will be okay. You're on your own again now, but just for a moment, it feels like it might make sense. Sadly, moments like these happen far too often for people with dementia in hospital. Imagine feeling like that, not just every morning when you wake up, but maybe every hour, every half an hour, even every 10 minutes. Imagine how frightening that must be. When you've met one person with dementia, then you've met just one person with dementia. Each person with dementia's journey will be different. But all of us, regardless of the role we play, can play a part in making their journey through hospital a better experience. At any one time, 1/4 of the patients in our hospital will have dementia. We know that they have longer lengths of stay, they're more likely to be readmitted, and they have a higher mortality than people without dementia who are admitted for the same problem. So people with dementia in hospital need staff who understand their needs. Staff who smile, introduce themselves, people who explain clearly what is happening, and who know the best way to communicate with somebody with dementia. People who want to get to know the person behind the dementia and find out what matters most for them. People with dementia in hospital need their family and carers to be a part of their care. A familiar face, a familiar voice can provide the reassurance, the continuity and the sense of well-being that a person with dementia needs to make them feel safe and secure while they're in hospital. Carers are the people who know the person with dementia best, so they should be an essential partner in helping us care for their loved one. Hospital environments need to be dementia friendly. People with dementia need environments that ease decision making, reduce agitation and distress, encourage independence and social interaction, and promote safety. At Barts Health, we're committed to becoming a dementia-friendly trust, and we've got lots of initiatives to help us do this. We have dementia training programs for all staff at all levels, and we have ward dementia champions who are trained. By the end of this year, we'll have a dementia and delirium team on every site, a team of clinical nurse specialists who are dedicated to supporting ward staff care for people with dementia. And we also have a carers policy that encourages carers to be a part of care, and carers badges that allow them to visit their loved ones at any time that they wish. We're working with Barts Charity to create some bespoke dementia-friendly environments at Whipps Cross Hospital, and we have a strategy to ensure that any new capital projects and any ongoing maintenance work takes account of the principles of dementia-friendly hospitals. So over the next few weeks, you'll see posters like these appearing around the Trust as part of our dementia-friendly campaign. They're encouraging you to take part in training, get to know about the initiatives we have that will improve care for people with dementia. But we also want your ideas and suggestions about how we can improve things. So I would ask you to please get involved, let us know what you think, and help us to become dementia friendly at Barts Health. Thank you.